Here to demonstrate the use of the new Dermapen. This is Tanya. We just finished washing her face. We have numbing cream on her. You can see how it starts to blanch her skin a little bit. She feels pretty good and numb. It's been on for about 20 minutes, so we're ready to proceed. First things first, to open your needle, it's a sterile needle. Make sure it has a little bit of slip to it so it doesn't get stuck. Here's your little Dermapen here. The insertion of this should be just so simple. Insert it in without force, push it into here, click, and then just snap it in and you're ready to go. Make sure that you examine the patient's skin. If they have any acnetic lesions or open sores and stuff, you'd want to be sure to avoid those areas. Today I think I can treat Tanya at about a 1.5 in depth. So here's my little depth gauge right here, and I can just turn that to the 1.5. You see this little dot here. So now we're going to be able to treat her today at this level. So I'm going to treat her around, our speed is going to be between 5 and 6. I believe that the faster you go, the easier it is on the patient, but in some areas you need to go a little bit slower. So first things we're going to take, and I'm going to wash off the skin with just a little bit of alcohol. Every time you do a procedure, you should start by just washing and cleansing the skin with alcohol, even after you've prepped the skin. And I only take off half of the area that I'm going to treat first. And I do start with the cheek. It's a little bit less painful than starting with the forehead. So just gently take off that numbing cream. And now we're going to use a hydrating B5 gel. And all you're going to do is make sure that you don't touch the applicator to the cheek. Just drop it. One drop usually does the whole area that we're going to treat for right now. And all you need that for is just a little bit of slip for your Dermapen. Okay, so now the most important thing when you're doing this treatment is to hold the skin tight. So I just take a 4x4 and I'm going to come down here and I'm going to press and keep that skin taut right there so the Dermapen can do its job. So I've got her on a 1.5. I'm going to turn my speed up to 6. And here we go. You ready, Tanya?
I'm ready.
Okay, so make sure that you're sitting up flat to the skin, that you're not tenting it up, because she'll feel those needles more if you don't keep it flat. Going to go in a slow motion and a vertical motion up and down, and I'm only going about 1 inch to 2 inches my first pass right here. I'm going to come up above that, still keeping my tip flat to the skin. You doing okay?
Yeah, that's fine.
As we get up to the cheekbone, you want to make sure that you're very careful with that. That's about as high as I'm going to go on her. It does get a little bit more painful as you get up near this area right here into the cheek. So just be aware of that. So I try and stay right here because I'm going to turn the pen down and I'm going to continue to treat that area. But for now, I'm just going to go up as far as I feel comfortable. Now I'm going to start taking it in horizontal swoops as I go down the face, making sure to pay good, so you're overlapping a little bit. So now I'm going to still keep it my speed at 1, and I'm going to turn it down to my 5. Now I like to treat their eyes. Make sure you have a lot of slip underneath their eyes. Take a little gauze again, and you're going to stretch that skin down, and you're just going to apply this straight up and down again and go right on that orbital rim. And be careful not to push too hard into the skin because it's going to be painful for them. So I just take this, press it down, and I'm going to do just little small C's going down that jawbone right there. Now I'm going to hold it tight, and I'm going to take it up here around the crow's feet. Mind you, I'm only at 1 now. I've taken it down from 1.5. Around here gets pretty darn painful. So here we go again. I'm just going to take, now I'm going to switch my vertical and my horizontal to little baby circles. Really focusing on my little marionette lines there. And I'm going to just circle, keeping the skin tight the whole time. And taking it all the way to the jawline. So you want to make sure that you've covered the whole entire area that you're working so it's all uniform and you haven't missed anything. So now I really want to work around the mouth here to get those little vertical lines to disappear. So I'm going to make sure that I have some good slip, and I'm going to use some more hydrating B serum here. And I'm going to keep it on 1, and I'm going to turn it down to 5. And I'm going to keep it really tight on the lip, and I'm going to stretch it, keeping my tip vertical. Now, if you tent it and go like this, you're going to end up cutting them. So make sure it's straight up and down. And come to the bottom lip and do the same thing. And you can see I'm just working half of her face because that's all I've taken off the numbing cream. A lot of people don't like these little lines here around the mouth, so I'm going to also stretch here, up and down, and I'm going to circle just in those little fine lines. As we start to age, those are bothersome to most of us, so we're going to get those as well. Okay, so now I've done one side of her face. I'm just going to turn off my machine here, put it in my little cradle. I'm just going to leave this as is. Now I'm going to go ahead and I'm going to wipe off this side of the face. Alcohol is stinky for your patients, so you might want to have them hold their breath. That's probably the most annoying thing that this treatment does, is the smell of the alcohol. So anyway, sorry about that, Tanya. Here we go. Okay, so once we've got that all clean again, we're going to take our hydrating B5 serum, and I'm going to apply it. And just turn your head to the side for me, thanks. One little drop, smooth it on. And then remember, you started at a 1.5 on the other side. So I'm going to do the same thing here. So I'm just going to turn my gauge back to 1.5, and I'm going to go back up to my speed of 6. Same thing, I'm going to take my gauze and fold it over. Make sure that your cord doesn't get over into your patient's face. Get it out of their face, because you're really trying to work on a sterile field here. Pull that skin tight. Here we go. There's my little short vertical strokes here. You see I'm walking my fingers up and down the jawline, making sure that the skin stays tight. Again, avoiding that cheekbone, just because that gets a little bit more painful. So when I get to here, now I'm going to take it in my horizontal pass here. A lot of your people will want to go extra fast. Make sure it's just very slow, continual movement. Tanya's still very comfortable. She's not flinching. She's still feeling really comfortable now. I'm still at a 1.5. Okay, so now I'm going to stop it, and I'm going to turn it back down to my 1. And now we're going to make sure we have enough slip on the eyes. And I'm going to retract that skin down. Vertical position again. Back and forth just over that orbital rim right there. My little C-swoops going down that jawline. And I really do work these eyes and around the eyes a lot. Your clients will appreciate you for that. These are hard to get rid of and shows our age, so we want to make sure that you get them. Now the nose can be very tricky. Make sure that you keep it flat against the nose. If you lift it up, you can cut them as you're going upward on the nose, so make sure you stay flat, and it's at a very slow motion. I love to stay right here inside that nose. That's a great treatment for them. Again, I'm going to try their lip. Stay as close to that vermilion border as you can. Back and forth motion here. stay in those little creases in the mouth and working that. Okay, so once we're done there, now we're going to move to the forehead. The forehead is the most sensitive part on the face. You see how she's got red? We've got a really good uniform look here on the face. So now, let's take off our numbing cream on the forehead. I don't treat the forehead any deeper than a 1. I do start at a 0.2 to 5 if they can tolerate it. Because it's so close to the bone, it gets a lot more painful for them. Okay, now I'm at the forehead, so now I'm only going to go the depth of the 0.2 because it is a lot more painful. And I am going to do it around a 5. So I start above the eyebrow here and keeping it flat and just slowly across that eyebrow. Moving slowly upward on the forehead. You doing okay there, Tanya?
Yeah, doing fine.
Stay right in that glabella area right there. I work this a lot for them. Little tiny circles here, or you can do straight up and down. You can do as many passes on a face as you want to. I mean, I like to get the full face covered, so I do a vertical pass, I do a horizontal pass, and I do little tiny circles if they can tolerate it. Most people can, especially if you have them comfortable and you have them numb. But, you know, if they're going to be here, be a little aggressive with them. You know, make sure they're getting a good treatment. And I'll show you, this machine has a new tip, a new little feature on it that can spot treat areas as well. And as soon as I'm done with her forehead, I'll show you how to do that. So I find that little horizontal passes and little circles on the forehead seem to be the most comfortable and work the best for what I'm trying to accomplish here. So I'm just trying to get all those areas covered. This pin has 11 little micro needles that go in a vertical position here that helps really get that skin tight as it starts to heal, providing a little collagen repair. What it's doing is creating a little wound in there, and the body has to then rebuild and repair itself, and that's where you get the shrinkage and the tightening from. Now at this point, I'm going to take the nose, and make sure you have some pretty good slip on the nose. Little dot here, Tanya, don't let me go. And what I like to do with the nose is just kind of spot treat the nose. If you go on it too aggressively, you'll end up taking the skin off the bridge of their nose. So I am just very gently just going over the nose here, making sure I get it all. And this is great. They can have an exfoliation treatment, or, you know, if they've got blackheads, this will take their blackheads out in the next 2 days. They'll just slide right out. It's amazing. Okay, so once I'm done now, I'm going to show you this new little treatment that we can do with this machine. And this is really great for actinic scarring and little pop marks. So turn off your machine, and now I can take it to the 2.5. And this is just like, if you've ever heard of fractional laser, this is what a fractional laser does, is it goes in and penetrates that skin. This is just without the laser. So this is a great little tool for spot treating some of those hard to get areas. Anyway, so that just kind of shows you there. Tanya doesn't have any actinic scarring, but I just wanted to demonstrate to you what that 2.5 can do and how aggressive it is, and that if you were to use it as a vertical or a circle motion, how you could really damage the skin. So at that point there, I'm going to take and I'm going to just cleanse the face one more time with alcohol just to sanitize the face. Now this may burn them just a little bit. And I'm going to take this off. And then once I've got that all off, this is when you're going to start putting whatever product you want on the skin. Now I like to take the hydrating B5 gel and just spread it all over the skin and give them one more drink of water here just for their skin, and kind of fill in those little holes that we've just made with our treatment.
That feels so good.
Just now you get the pampering part of the treatment after we've done our little needling here. So at this point, it's up to you to customize the facial to whatever you feel like you want to do for your client, whatever needs. Put a little peel on that afterwards for them. Most important thing is to get a good epidermal repair cream on their skin and some sunscreen. So they will get dry in about 3 days. They'll have that cellular change, that turnover again, so they'll feel really tight. It's just really important for your clients to really keep their skin moisturized. And 5 to 7 days, they'll have a whole new face. So there you go. That's the Dermapen.